How do cystic fibrosis patients navigate IVF fertility treatments? Imagine facing the challenge of building a family while managing a complex health condition. That's what many people with cystic fibrosis experience when exploring fertility options. Cystic fibrosis affects the reproductive system differently in men and women, so their paths to parenthood often vary. Working closely with healthcare teams is essential to safely and effectively navigate fertility treatments like in vitro fertilization. For men with cystic fibrosis, infertility is common because of a condition called congenital absence or blockage of the vas deferens. This means sperm are often produced normally but cannot reach the semen. To overcome this, doctors may perform surgical procedures to retrieve sperm directly from the testicles or epididymis. These sperm can then be used in assisted reproductive techniques like in vitro fertilization. This approach allows fertilization outside the body, bypassing the physical barriers caused by cystic fibrosis. Women with cystic fibrosis usually have healthy eggs, but their fertility can be hindered by thickened cervical mucus and changes in the reproductive tract. These issues can make it harder for sperm to reach and fertilize the eggs naturally. To improve chances, fertility specialists often recommend medications to stimulate ovulation, followed by intrauterine insemination. During intrauterine insemination, washed and concentrated sperm are placed directly into the uterus, increasing the likelihood of fertilization. If this method does not succeed, or if additional fertility issues are present, in vitro fertilization becomes a valuable option. In IVF, eggs are retrieved from the ovaries after stimulation, combined with sperm outside the body, and the resulting embryos are transferred into the uterus. Before starting fertility treatments, patients with cystic fibrosis undergo comprehensive health assessments. These include evaluating lung function, nutritional status, and checking for complications like cystic fibrosis-related diabetes. These factors influence both the safety of pregnancy and the success of fertility procedures. Pregnancy can pose additional risks for women with cystic fibrosis, such as slight declines in lung function and the development of gestational diabetes. Therefore, close monitoring by a team of specialists is crucial throughout pregnancy. Genetic counseling also plays a key role. Since cystic fibrosis is inherited, couples are often advised about the risks of passing the condition to their children. Pre-implantation genetic diagnosis can be used during IVF to select embryos without cystic fibrosis mutations, helping parents make informed choices. In cases where pregnancy might be unsafe due to health concerns, options like using a gestational carrier or surrogate are considered. Overall, managing fertility in cystic fibrosis involves a team approach, balancing the desire for children with medical safety. Many women with cystic fibrosis have successfully conceived and delivered healthy babies through IVF or intrauterine insemination. Men with cystic fibrosis can father children with sperm retrieval combined with assisted reproductive techniques. Regular consultation with cystic fibrosis specialists, reproductive endocrinologists, and genetic counselors ensures personalized care tailored to each individual's health and reproductive goals. Remember, every person's journey is unique, and with proper medical guidance, building a family is often possible despite the challenges cystic fibrosis may present.